Hey there, welcome back. Today I want to talk about leaking during postpartum running or just leaking postpartum in general, but specifically during running, why it's common but not normal, and what you can do to help ensure that it doesn't become a lifelong issue for you right after you give birth. Welcome back. Like I said, I'm happy you're here. My name's Dr. Abby Siler. I am a physical therapist, runner, herbalist, mom, and just someone that wants to help you as a runner and as any athlete get back to running and stay active without injury, without issue, without health issues, and make sure you just really enjoy life and an active life pain free. So, like I said, leaking while running. Many women experience it. It is very common, but just know just because it's common, it's not something you have to live with and it's not normal. So, postpartum experiences, they vary huge between people, between women. My postpartum experience is going to be completely different than someone else's. Sure, there might be some similarities and some similar experiences and some similar things because there are some common things that experiences that happen postpartum, but no one woman is the same when it comes to their postpartum experience and their postpartum journey. Because one body isn't the same. One woman's postpartum experience from one baby to the next is also going to be completely different because our bodies are different. But one common challenge many women, and actually most women, face is urinary incontinence, particularly during activities like running, jumping, sneezing, coughing, laughing, just being active in general. So, I kind of want to dive deeper into the prevalence of urinary incontinence postpartum and what the impact of it is on women's lives and the role of what rehab, urinary and pelvic floor rehab, can do in addressing this issue. Okay, the truth behind postpartum links during running. This is what I want to focus on. Flashback before pregnancy, you were, picture this, crushing your training runs and seeing huge fitness gains. That was me. I was training for a half. I was getting ready to PR. Then I got pregnant and it completely derailed things. But my pregnancy journey was completely different. Like I said, we can go into that story another time. But that's the common story that I hear is before pregnancy or even during pregnancy, you were running, no issues, crushing goals, setting PRs, ready to go. But then after baby, and when you started to try to return to running, you started to leak every step of the way, possibly even with some pain in the pelvic floor region. Just know that you're not alone and that over half of new moms deal with the embarrassing, it's embarrassing, but it's not, leakage like stress urinary incontinence that hinders their activity enjoyment. We want to enjoy our activities. We are runners. Most people are runners because we love to run. There are plenty of fun exercises out there that you can do if you don't like running to get the cardiovascular benefit. Running is not the end all be all. But if you are a runner, you do it because you love it and you enjoy it. And having stress urinary incontinence or SUI during runs really takes the enjoyment out of it. Trust me, I've been there. It took it out of it for me. It was a hassle. It was something that I had to think about, had to wear pads, had to deal with all of that. And that's just takes some of the fun out of just going out and running and relaxing because it's extra stress. It's extra stress on your mind, it's extra stress on your body, and that's something we want to avoid. But if you're taking the enjoyment out of running, but you still want to run because staying active is important, especially after baby, especially for the rest of our life. It boosts our mood, it gives us more energy, especially as new moms. We need all the energy we can get. And also helps maintain that elusive baby weight and get rid of that baby weight that we all gain and have a huge goal to get rid of. But how do we connect and regain our baby running freedom minus the misery and misery inducing messiness of postpartum of urinary leakage when we run, when we sneeze, when we cough, when we laugh, when we jump, do anything that we want to do that a lot of times causes leakage. Now, some women have all of the symptoms, some only have parts of them. But how do we bridge that gap to make sure that we can get back not to our pre-pregnancy levels because we can be better than pre-pregnancy, postpartum versus prepartum. pro antepartum or yeah. Postpartum is completely different. Our bodies are different. Our hormones are different than what we were pre-pregnancy. So nothing's going to be the exact same, but we want to bridge that gap and get back to the equivalent of what we were pre-pregnancy. Maybe not the same, but the equivalent. That's our goal. So, little history, a little anatomy of what happens during pregnancy. Your pelvic floor muscles, they are stretched immensely to accommodate for a baby and to help accommodate for the baby's passage to the vaginal canal when you have a vaginal birth. So think about it. You're pregnant. We've been there. We all know what it feels like. You got the baby sitting there. You got a bowling ball sitting on your pelvic floor muscles. They are being overworked and stretched out for 3 to 4 months because during the first and second trimester, they're not having as much stressing. But then you also have weight gain because we have to gain weight during pregnancy. Most women need to gain weight. Then you also have hormones like relaxin that further soften and relax down the supportive connective tissues in order to help with the road to birth. And then on top of that, some women have other accommodations, we'll say accommodations, that help enable delivery, like they are having a assisted delivery, something else. Some of the other situations that happen when we deliver also puts excess strain on our pelvic floor muscles and the structures down there. With all of this, these physical adaptations for delivery, things that happen during birth, things that happen during pregnancy, we are 100% predisposed to having leakage issues down the road as our pelvic floor and vaginal tissues recover post birth. And I say recover because it is a recovery process. I'm going to say it, I don't like comparing being pregnant to an injury, but you injured your pelvic floor muscles from being pregnant and from vaginal delivery. And for all intents and purposes, we've talked a lot as a runner, you know about overuse injuries. Pregnancy, vaginal birth, pregnancy part is an overuse injury. You are overusing your pelvic floor muscles, your hip muscles, your abdominal muscles, because it's a fast, in the grand scheme of things, it's a fast process that puts a lot of stress and strain on those muscles, which is what an overuse injury is. Then you have the traumatic type of injury. So there's two types of injuries. There's overuse and there's traumatic. Overuse is from prolonged, too much, too soon, that type of stuff. Traumatic is a singular event that caused an injury right then and there. So you have the overuse injury from being pregnant, and then you have the traumatic, it's not traumatic, but that's what it's called, injury from vaginal or C-section, cesarean section birth, because that's a one-time event that causes extra damage, tearing, incisions from C-section, all of those things. They're going to predispose you to have a high likelihood of having leakage postpartum or other pelvic floor dysfunctions. There are other things that can happen with your pelvic floor because of all of this postpartum that don't necessarily include leakage. There's pelvic pain, there's pain with insertion, there's urinary retention, there are other things, but the most common one is that leakage. Okay, so many of you are probably wondering, great, this happens during pregnancy and postpartum, but why is running causing the accidental urine loss or the stress urinary incontinence? And that's a great question. Stress urinary incontinence, what it is when it's a result of when intra-abdominal pressure overrides what the urethral closure pressure can withstand, causing involuntary release of urine. So what that means is your pressure in your abdomen is too strong. It overwhelms what your pelvic floor is able to tolerate. So there's an imbalance, there's a muscular imbalance there. And when you are doing jolting movements like running, hopping, climbing upstairs, sneezing, coughing, that causes an increase in your abdominal pressure, which then puts that pressure down your pelvic floor, which it isn't able to tolerate, and you leak because it's not able to keep that urethral closing closed. So the weakened pelvic floor contraction fails to compress the urethra quickly enough to keep things locked up urine per se, specifically locked up into your urethral canal when you cause an increase in abdominal pressure, such as with running, bouncing, jolting. And so, some of the risk factors that will predispose you after childbirth to having urinary incontinence, stress urinary incontinence that we talked about before are pelvic floor muscle over lengthening to fit the baby's head circumference, vaginal tearing, or operative deliveries can further damage your local tissue, including your nerve supply, your pudendal nerve. There are postpartum hormonal shifts that then perpetuate the laxity and weakness that started when we were pregnant. Then there is the chronic repetition of improper pelvic loading patterns, which were happen during pregnancy. Basically, this is saying what I'm saying here is there are faulty movement patterns that happen that cause strain to already vulnerable post-baby support structure. So when we're pregnant, we have that anterior pelvic tilt. I'm not saying anterior pelvic tilts are bad. Everyone has a continuum, but we have that anterior pelvic tilt because we got the round belly and we're arching our back and our abdominals get stretched out and that shortens and lengthens and there's a whole bunch of stuff going on. That causes some different movement patterns than what we're used to doing, than what our body is naturally used to doing, that we need to recover from. There are also the genetic predisposition factors, congenital collagen deficits, defects, smoking, obesity, advanced age, or your menopausal status can also all affect your pelvic floor dysfunction. So, with pregnancy and delivery, though, with all of those things, those are usually the final straw that really provoke the stress urinary incontinence postpartum. But avoiding running because you have it doesn't mean that you just can't run anymore, that it's something that you have to deal with. Like older generations have told us, you don't have to just live with it. There are things that we're going to do to help fix these foundational instabilities so that way we don't perpetuate these issues long term. Okay, something that I have preached, I feel like until I'm blue in the face with all of these postpartum videos and return to running postpartum is that returning to running postpartum takes a lot of patience, progress, and appropriate load management to recover. Time. What this boils down to is you need to give it time. We might, as women, be released postpartum by our OBs at 6 weeks for activity. That's great. What that release does not involve, or what the caveat to that release is that just because you're 6 to 8 weeks postpartum and you're released to do activity, that does not mean it's time to jump back into running. Our bodies are not ready. Most women at that 6 to 8 week mark have not done the work required to rehab the pelvic floor in order to take on the load for running. So postpartum healing, like I said, it takes a lot of time for those overstretched and traumatized tissues to remodel again, strengthen. And rushing back into activity too soon, or intense activity too soon, then continues to overstress those vulnerable areas of the pelvic floor, which then provokes injury, can cause pain, increase your risk and likelihood and the frequency of your stress urinary incontinence, and overall delays your recovery and sets you back for running further and further. While you might be running, it will set you back from getting back to and setting those PRs and hitting your goals that you want to hit postpartum. So what we need to do is follow a gradual loaded continuum that allows for there to be adaptive capacity to develop slowly without forcing convalescing muscles and connective tissues beyond their safe thresholds of what they're capable of doing right now. It is just like a regular injury. Any other injury that you deal with, you have to take the time, you have to put in the effort, put in the work to recover and rehab it before you can return to activity. There are principles that we follow that and guidelines have how tissue recovers, and it requires progressive incremental loading that provides the appropriate dosage of tension and impact in the right progression that helps with the realignment of the collagen matrix components and accelerates the fibroblast proliferation and maturation in your pelvic floor. That's a bunch of scientific terms. Basically, a slow progression that is correctly loaded, because Like any injury, any overuse injury, too much, too soon, too fast is going to cause problems. So we need to do it slow and steady in the right order, in the right amount to really rehab and heal those tissues correctly so that way they don't have cause problems long term. So what we want to do is we want to add gentle loading early on, which then it helps progress the collagen synthesis and also helps increase the circulatory delivery of nutrients and oxygen that's necessary for those tissues to heal and regenerate. So we'll start, you want to start gradually and slowly progress over. And I have a program coming out that's going to help you do that and teach you how to progress slowly, what you should do in the first couple of weeks, even before you're released for activity, all the way up to getting you back to doing your running and highly loaded activities without the urinary stress, without leakage. Complete resolution, complete rehab of your pelvic floor postpartum, it takes time. There aren't any quick fixes. It's not just a matter of do a whole bunch of Kegels and you'll be ready to run again. Doesn't work that way. We got to take time. Kegels are a good component, are a good portion of it, but they're not the end all be all. There are a whole bunch of things that go into the pelvic floor complex. It is not just your pelvic floor, it's not just those muscles. It is your hips, your low back, your core, your diaphragm. Everything combined together is your pelvic floor complex, and it takes time to gradually load those and recover them. And there's lots of different things that you need to work on, not just Kegels. So, what I get asked a lot is what is the pelvic floor? The pelvic floor is basically a hammock of muscles that span inside your pelvis. They include the levator ani, the coccygeus, and the circular external urethral sphincter. They, in coordination, in coordinated unison, they provide vital support. They are a hammock for your bladder, your uterus, your rectum, and your small intestine to help maintain proper anatomical alignment against gravity, because gravity comes down even during dynamic moving body positional changes. Also, this sling, this hammock of the pelvic floor, it also stabilizes your hip and your lumbar spine. It plays a huge, it's a key component that helps optimize your load through the entire chain from, like I said, your abdominals, your diaphragm, and pretty much down into your hips, into your knees. I have knee patients that come to me for PT that are having knee issues and they've done everything and they're still having issues. We take a step back, we work on the pelvic floor, and that was that missing link. So the pelvic floor is often overlooked in a lot of running injuries and a lot of injuries of the lower body. And come to find out, the pelvic floor was the issue. That was the last little link. It plays a huge part, like I said, of helping the hip complex be stabilized. It ties everything together. So, what are some of the symptoms needed that show that you need pelvic floor re-education? We're going to call it re-education. It's rehab, it's re-education. You're retraining your pelvic floor muscles for your new body. One is the big one that we've been talking about, stress urinary incontinence. So leaks with coughing, sneezing, activity that require pad usage. Some people don't use pads, but pad usage. Urgency and frequency issues of going to the bathroom. Bowel incontinence. Pelvic organ prolapse, which that's the pressure. You have that if you're having a feeling of pressure, heaviness, or bulging in your vaginal area. And then also any type of sexual dysfunction, so decreased arousal, discomfort with insertion, those are all symptoms that show we need to work on the pelvic floor postpartum. Those are some of those are a little bit more complicated that can't be addressed just with my program that I'm creating. Most of them can, but it's always a good idea to get a one-on-one consult from a pelvic floor therapist. You can also do that online with me. I consult virtually, so that's a great way to kind of add into what the program is going to do for you. So, like I said, Pelvic floor retraining isn't just a matter of doing Kegels and pelvic floor exercises. There are other things that help re educate and retrain the pelvic floor, postural retraining being one. Like I said earlier, when we're pregnant, things get a little out of alignment. I don't like to say that, they come back. Alignment is a hoax. There's no such thing as perfect posture, but there is an overused posture. My corny saying, motion is lotion. Motion is lotion. We are not made to stay in one position. During pregnancy, though, our bodies are put into a certain posture and we stay there for 9 months. So our tissues kind of get retrained to stay in that position and they don't move out of that position very well. So while we are saying postural retraining, what I'm saying is that we're getting things moving a little bit better again because you've gotten into the habit of staying in one position. And that's where our muscles get overworked and we start to have pain because we're not moving like our bodies were made to be. So during pregnancy, you get that overarched low back posture that increases actually intra-abdominal pressure on the pelvic floor because of the tilting, because of how your abs are not supporting anyway. And it also is weakening your core stabilization. So postural retraining, that's a component of it. Another one is breath retraining. When we are pregnant, we have a bowling ball sitting in our stomach, compressing our diaphragm. The correct way, there is a right and wrong way to breathe, kind of. I mean, if you're breathing, that's the right way, but there are better ways to breathe. And that is the right way, the better way to really activate and get the full benefit is deep belly breaths or diaphragmatic breathing. But during pregnancy, because of this bowling ball in our stomach, we're not able to do belly breaths. So we end up becoming chest breathers. So up and down here. So we're not getting the lengthening and the stretching and the cohesion of movements that we need in our diaphragm, in our core, and in our pelvic floor. Okay, so in conclusion, we're going to wrap this up. One of the big myths about postpartum incontinence is that many women are told by older generations or other women, and they themselves just assume that leaking while active, months, years after delivery, remains inevitable, and that it's just part of being a mom. Or that with advanced age, accidents also just have to be put up with versus fixed. Because women, as we get older, menopause, everything like that, that can also cause leakage. That's wrong. That's a myth. It's a lie. It's a lie that you've been told from uneducated, unexperienced people. However, we can and that, so it's not something that you just have to live with, and it's not just part of being a mom. It is something that we can do, we can fix through, like I said, proper rehabilitation to fix the damaged, irritated, weakened supportive connective tissues and over lengthened muscles that help restore your anatomy and your function so you can get back to running without pain. Stay tuned. This channel, I'm going to have more and more on postpartum pelvic floor, herbalism, helping with running injuries, how herbalism can help with endurance and support you as a runner, other running injuries and issues to deal with. And stay tuned. That's all coming up next.